Morning, folks. Okay. Good morning, everyone. Thank you so much for joining me here today. Since we formed government, we have been focused on shifting the culture in healthcare. A culture that values frontline workers, that puts patients at the center of care, ensuring that everyone is able to get the care that they need. Over the past 18 months, we have worked very hard to refocus the system on what patients and the front lines want to see. That's shorter wait times, more staff, and more beds. But we haven't always seen the health system focus their resources on the same things. There is a disconnect between the message that our government has been saying and the decisions that healthcare leaders in some cases have been making. This is about how we govern our system. It's about how we direct the resources government provides to the services that Manitobans want and deserve. Healthcare leadership have become accustomed to a culture of scarcity and fear born out of the previous government and their approach, where cuts were rampant and support to the front lines of our healthcare system were absolutely minimal. Now, we've tried to correct this as a government by issuing very clear directives to health system leadership that cannot be ignored. Directives like moving 8% of funding from bureaucracy to the front lines and cutting agency use by 15%. All of this to respond to what patients and frontline staff have been asking for. After years of PC chaos, Brian Pallister's cuts in consolidation, Heather Stephenson's growing bureaucracy, the health system had lost its focus. And it's time to bring that focus back. Earlier this morning, the boards of Shared Health and the WRHA, our two largest health authorities, appointed new interim CEOs. Dr. Chris Christodoulou will oversee Shared Health. Dr. Chris Christodoulou is a strong clinical leader who will bring his patient-centered focus to Shared Health. He's a highly respected, highly regarded physician who has worked across our communities, across the province for many, many years. Jane Curtis has agreed to step away from her role as CEO in Southern Health to lead the WRHA. Jane is an emotionally intelligent leader with a record of delivering excellent patient care while meeting fiscal targets. I'm confident that these two exemplary Manitobans will embrace the new culture in healthcare our government has been elected to create. I want to thank Lynette Siragusa and Mike Nader for their work. These are difficult public service positions. These are two folks who I know care deeply about Manitobans. I also want to say our government will be taking more steps to improve healthcare governance that I can share in the future. If the disease in our healthcare system is a culture of dysfunction, then the symptom of that disease is fiscal mismanagement. Over and over again, health authorities are spending their resources on the wrong things. Spending on private agency staff instead of public nurses. Spending on bureaucracy instead of spending on the front lines. Spending on out-of-province and out-of-country contracts instead of on patient care right here in Manitoba. In January, January 2024, our government commissioned independent auditors to undertake a comprehensive review of nearly every health authority. These audits revealed very real systemic government failures that have undermined morale for frontline workers while worsening the culture in our healthcare system. They've shown that there's a breakdown of communication between health leadership and government. All of these identified concerns only worsen patient care. The audits say, and I quote, "The processes, approaches, and culture appear to have shifted to a point where collaboration can, at times, appear to be at odds. This creates governance challenges in holding each SDO accountable to its mandate," end quote. Let me be clear. The lesson here is not about cutting funding. This is not to cut funding. It is to establish an accountability structure that ensures resources are directed where they need to be, that ensures resources are redirected from bureaucracy, as one example, to the front lines and to the bedside of Manitobans. It's important to say this very clearly. The PC approach to close emergency rooms, cut frontline staff, scrap services, did nothing to deliver more effective healthcare across our province. It did the exact opposite. What the PCs did, the approach that they took, led to longer wait times, frustration, and challenges on the front lines for staff and sicker patients across our province. Their approach to healthcare ballooned the bureaucracy. It pushed healthcare leadership further and further away from the front lines and away from the bedside and made patients worse off. Now, we've made progress. We've made progress building up the healthcare system across our province, and this is good news. We've hired over 870 net new healthcare workers, with more on the way. We have added hundreds of fully staffed beds to our hospitals. We've increased capacity for surgeries, and we're opening more primary care clinics, making sure that more Manitobans across our province have access to a primary care provider. Today is another step that's being taken to get us closer to ensuring that every single Manitoban has access to the care they need, where and when they need it. I thank you for your time, and I'll open it up for questions now.
Just having a brief chance to glance at the report that's been handed to us as you stepped into the room. It seems to refer to a major driver of cost being collective agreements and adding more staff. Mm-hmm. Your government has promised to add more staff and to help with retention, recruitment through higher wages. So how is that the fault of the SDOs?
That is not the fault of the SDOs. As a government, we've been very clear. We value the front lines. We know that their contributions to making healthcare is invaluable, and we know that we need more people on the front lines of the healthcare system. What the report is really highlighting is that for many years under the previous government, we lost hundreds of staff. Hundreds of staff were cut from the system. And we know that frontline nurses, allied healthcare professionals, support staff did not have the ability to have fair contracts. They were dealing with a government that wouldn't bargain fairly. They were mistreated in a way that resulted in us having less capacity on the front lines, not more. And so while we certainly recognize that more staff adds more costs, those are investments in strengthening healthcare that Manitobans need and deserve. When we talk about adding beds, we're talking about adding people to provide care at the bedside of Manitobans. We want all healthcare workers, and we've been able to see this happen with nurses and support staff, to have fair agreements, contracts that support them in having a good work-life balance and being motivated to work in our public system. So, we are going to continue to do the work of staffing up the front lines, recruiting net new healthcare workers, and listening to what they have to say as we make the system stronger. But, 7.5 years of a completely different, basically opposite approach has consequences.
This report, and again, I've had just a few minutes to look at it. Mm-hmm. This report seems to point to, as with any organization, the prime driver of cost increases being wages and staff levels. Yeah. So are you providing, is the deficits at these regional health authorities the result of government underfunding for the staff and the collective agreements that they now have?
No. So it's important to also note that these reviews, these audits are from 2019 and 20 to 2023-24. So it's really examining the record and the approach of the previous government in terms of their fiscal approach. We're looking at a time where we know that the government was making cuts to healthcare that we actually see results in higher impacts fiscally, right? You have sicker folks. You have folks working overtime. You have increasing costs around agency use. Our government has examined all of that. We recognize that it's far more affordable and fiscally responsible to have folks working in the public system and not relying or over-relying on agency use. It's far more beneficial to the system to have folks working straight hours and not overtime and mandated overtime. And so we've taken steps to hire net new healthcare workers, which we know will make a difference on that front. And so, a couple of other things that were really highlighted in the report that I think are really important is the relationship around governance. The previous government's approach, and it's pretty clearly articulated in these reports, did not empower the boards to hold leadership accountable, did not empower the boards or give them the tools that they need in order to, execute decision-making around budgeting is one example, as well as they could. Our government and myself as the minister have made decisions to strengthen the boards, and I want to commend them for working with us to move things in a better direction.
Have steps been taken to bring the health budget back in line to where it was, or is it getting worse?
Steps have been taken to take a more fiscally responsible approach. Appointing new board leadership at Shared Health, Dr. Postal, and at the WRHA, Dr. Anderson, and in addition to them, board members who have wonderful capacity, fiscal expertise, legal expertise, and understanding of the healthcare system have been great additions and great added strength that was necessary for board governance. We have been able to work with them to move things in a better direction and to take steps that the previous government had 7.5 years to do but never did, which quite frankly, in my role, I don't understand. We have engaged the boards and we have engaged with leaders to have greater fiscal understanding and responsibility, including having the regional health authorities present their annual operating plans at Treasury Board here at government, which is a really important step, and it helps build a good bridge between government and the boards and the regional health authorities. So we've taken steps to move things in a better fiscal direction, and we're seeing that hard work and partnership and collaboration pay off. We recognize there's more work to do, and the audits are going to help inform that.
Minister, can you speak to why Southern Health was excluded from these reviews?
Southern Health, which is the regional health authority that Jane Curtis will be leaving to join the WRHA, has a proven track record of balancing their budget. Jane Curtis is a leader with a high level of emotional intelligence, an understanding of the importance of building strong teams, strong fiscal teams and infrastructure, and they have been successful at doing a zero-based budgeting exercise year over year and delivering a balanced budget while making efforts and taking steps to improve patient care.
What do you think is the difference there? What
Yeah.
has been the main difference?
That's a great question. It's a great question. Over the past over 1 year, we've had the opportunity to meet with leaders across the healthcare system and see how they're making their decisions and how they're getting the work done and how we can support them in moving healthcare in a better direction. I will say that in Southern Health, under Jane Curtis's leadership, they have a great culture around fiscal accountability. They have a great culture around listening to the front lines and working with their teams to make important and sometimes difficult decisions in terms of the best ways to improve patient care. That is a team over there that puts patients first and that recognizes that every dollar possible should be going to the bedside and to the front lines of the healthcare system. So I think very highly of Jane's leadership, her leadership style, and the way that they were able to build teams. And I do think that they serve as a very good example of the good that can happen when you are that fiscally structured and responsible.
Minister, have you shown the unabridged the results to the health region CEOs already?
They've been provided copies of the reports.
Okay. Did you provide any direction, Minister, with regards to the shakeup in leadership?
The decision for leadership in terms of CEOs, those are board decisions. So again, we've made changes. I've made changes to board leadership at Shared Health and the WRHA over past months. Two leaders who are highly respected, who have been really great to work with, quite frankly, and who understand the priorities, mandates, and values of government and what Manitobans have sent us here to do. We work very closely. I work very closely with them and will continue to continue to strengthen governance and to take the necessary steps to make care better at the bedside. So, the 8% exercise is a really good example. The direction that I gave for regional health authorities to redirect 8% of their resources from bureaucracy, which was ever growing and bloated under the previous government, to the front lines of the healthcare system and to the bedside of Manitobans, was a necessary direction to give. It's part of changing the culture in healthcare, changing the culture around how we manage finances to prioritize patients. Patients have to come first.
So the changes announced within minutes of each other at Shared Health and WRHA, you had nothing to do with that? This was not a provincial directive, this was coincidental?
Oh, I worked very closely with the boards. I take their expertise and their advice very seriously, their feedback seriously. These decisions are made by the board and led by the board chairs rather. But certainly as the minister, I work very closely with leaders throughout our healthcare system, including the boards, to understand areas of opportunities to improve, to work together, to work in collaboration to strengthen healthcare. And I take their perspectives very seriously. And I also have to state that, you know, a lot of the decisions that I make as the minister are directly informed by the front lines. We've been on a listening tour since the very beginning. I meet with healthcare workers, nurses, doctors, allied healthcare professionals, support workers on a very regular basis. I'm in daily communication with folks on the front lines of our healthcare system. And so we also hear their voices. We also take their feedback very seriously. And of course, all of that information factors into decisions that are made.
Are you considering merging WRHA and Shared Health?
That's an interesting question. At this time, our priority is making sure that the healthcare system and regional health authorities have the leadership and the capacity and the accountability to deliver better services for Manitobans. Certainly, as the health minister, folks bring forward all kinds of ideas in terms of what they believe will help strengthen the healthcare system. Folks have, asked me questions or talked about more regional health authorities or less regional health authorities. As the minister, I'm open. I remain open to doing whatever is necessary to make sure patients are receiving the best care possible. We've made changes and taken steps as a government already to strengthen patient care, and we'll continue to do so. At this time, not looking at any changes like that, but certainly when it comes to making sure that Manitobans are receiving the best care possible at the bedside, I'm a listening minister, and I'm open to feedback.
I ask because your government has made it clear it's not really a fan of shared health. They consider it an added level of bureaucracy.
You know what? I was a nurse on the front lines of our healthcare system when shared health was created. I lived the impacts of the previous government's callous approach to healthcare and their disorganization. I know that there was a vision for shared health that people were very optimistic about. I think the previous government was so focused on cuts and consolidation and closing emergency rooms and making cuts on the backs of healthcare workers that they weren't able to execute any sort of vision in a positive and productive way. And like I said, I experienced that myself as a nurse on the front lines of the healthcare system. Our goal as a government is to do what is necessary to make sure Manitobans have the best care possible at the bedside, that no matter where you live in our great province, you are able to access the quality health care you deserve. And so that means making sure that we're strengthening our boards, that we're being fiscally responsible, we're investing in more frontline staff, which we're doing and will continue to do, and that we're listening. So I think it's really important that every single regional health authority has the resources they need, the leadership that can manage them well, and we'll keep working with them to make sure healthcare is moving in the right direction.
Minister, can you speak to this disconnect in more detail? What did that look like in reality on the front lines between the decisions that healthcare system leaders were making versus the direction from the government?
Sure. We know from the audits in particular that there were really no open lines of communication between the previous government and SDOs and the boards. The boards were not empowered to make decisions around budgeting or governance that would really benefit the system. As minister, I take very seriously the responsibility that boards have to hold leaders accountable and to serve a very important function in the healthcare system. We've made changes to boards, the WRHA and Shared Health, really good changes. We've brought in fantastic leaders, folks with expertise on the boards who are working very, very hard to move healthcare in a better direction. These are folks who care deeply about patient care and who have been wonderful to work with, quite frankly, in terms of taking necessary steps to strengthen healthcare. And so we're going to keep those relationships going. We're going to keep working with them and improving the lines of communication that the previous government completely cut off. As the Minister for Health, I know how important it is to be engaged and be listening and be working with our partners. The previous government did not take that approach, and there were consequences for that. And we saw a real lack of transparency, a lack of empowerment of boards to do what they need to do. And we saw that the government was actually able to make cuts and decisions without engaging with the folks who really are at the heart of the system and how it operates. So we're taking a different approach. We're opening those lines of communication. We're empowering our boards. We're strengthening them. We're working with them, and we'll continue to do so.
Minister, you speak a fair bit about the culture, and I wonder if there's any plans to how that will be measured. How will the cultural change be measured? Are there any plans to do workforce surveys or that sort of thing?
That's a great question. Culture in healthcare is so important, and changing the culture is something that the Premier and I have been working really hard to do in healthcare. We also recognize that changing the culture in healthcare is probably the most difficult challenge to take on. But it's definitely the most rewarding and important for us, because there's so much that is, that exists within that, including fiscal accountability and changing the culture there, including, how we treat our frontline staff and their morale and how they feel about the work that they do. And so, as a government and as the minister, we measure culture and whether or not we're moving things in the right direction by stats like nurses leaving the private system to return to the public system. We've been able to see a good deal get done with nurses in this province. We've been able to see the benefits of treating nurses well and with respect. We have nurses, I think we're about 200 nurses now who are in the provincial nurse float pool, and those numbers are increasing. That's a good sign. When we see nurses leaving the private for-profit system and moving back into our public system of healthcare, that's a good sign. Making sure we have more healthcare workers on the front lines, seeing a net increase of healthcare workers in Manitoba, that's a sign that things are getting better. And we recognize there's much more work to do.
So to confirm, no plans for any kind of workforce survey at present?
Well, we have surveys that are attached to different initiatives, right? So a good example would be our weapons detector pilot is a good example. So we did surveys there to assess how patients, staff, and visitors felt about those weapons detectors being used, and we got their feedback, overwhelmingly positive feedback. Staff, patients, and visitors alike really appreciated having weapons detector technology at HSC, and so we moved forward with that, and I'm happy to say that those will be on site right away at HSC. And so we check in different ways, many different ways with frontline staffs, but we also use the metrics in the healthcare system, vacancy rates, net new healthcare workers, nurses returning to the public system, all as ways to assess what's happening with the culture. But one thing I can say is that what I've heard loud and clear from folks is that they want their leaders to be emotionally intelligent. They want their leaders to listen to the front lines, and I'm confident that Dr. Chris Christodoulou and Jane Curtis are those leaders.
Are there plans to continue with the audits for 24, 25, or is that work done for now?
Oh, the work is never done. The work is never done. We're gonna learn everything we can from these audits. We're taking them very seriously. We're digging into the details. As a government, we've already taken several steps to improve fiscal responsibility and empower boards to do what is necessary to move the system in the right direction. But we're going to continue to work on improving fiscal approaches across regional health authorities. We're going to continue to take steps in partnership with boards and health leaders to move the system in the right direction. So as a government, we're constantly assessing and reassessing the fiscal landscape in healthcare and taking steps as needed to strengthen that.
Do you have a figure for how much these audits cost?
I don't actually top of mind. I can get that information to you. I can say that our government sees a lot of value in investing in understanding how we take a more fiscally responsible approach and how we make sure that patients have the best care possible. We want to make sure that every dollar that can be spent at the bedside of Manitobans is spent at the bedside. We want to make sure that we are spending as much resource as possible directly on the front lines of our healthcare system. And so these audits and other steps that we're taking give us the information that we need in order to do just that.
Is there anything that the health regions have been doing well?
Yes. Oh, yeah. That's a great question. I do think it's important to, again, I can't speak highly enough of the board chairs that we have at Shared Health and the WRHA. Dr. Anderson and Dr. Postal are great healthcare leaders. The regional health authorities, it's in this role as the health minister, it's been a real pleasure to work with frontline staff, managers, folks throughout the system, the boards who are all committed on one thing, and that is making sure Manitobans have the best care possible at the bedside. I was just recently at a federal, provincial, territorial health meeting in Halifax, sitting with my counterparts across the country, hearing about their challenges in their own jurisdictions. And I left that FPT feeling even more confident in what I felt going in, that we have the best healthcare workers in the country right here in Manitoba. We have the best healthcare workforce. And so we're going to continue to do everything we can to strengthen the workforce here in our province, make sure our frontline staff are supported and able to really lean into providing quality care, the work that they love to do, and make sure that patients have the best care possible at the bedside.
Are you confident you're giving health authorities enough money for the increased staff and the collective agreements? I mean, there's ongoing collective agreement
Yes.
negotiations. You've promised more staff, paying them more. This can't all be done just by shifting some 8% of administration costs.
Of course. Yeah. Our government's number one priority is healthcare. That is Manitobans' number one priority, and our government will continue to make sure that we are investing in strengthening healthcare, investing on more people being on the front lines. Our 24-25 budget had a net new $1 billion in the healthcare budget to deliver services to Manitobans. We believe very firmly that healthcare workers should have a fair deal, that they should have contracts that support them in being able to show up for work every day and have a good work-life balance and be excited about providing care in our province. And so we know that the return on investment in investing in healthcare workers, investing in training healthcare workers and retaining them is what's in the best interest of Manitobans. So, we've not only invested in net new healthcare workers, but we've also invested in increasing training seats. So if you're someone who's interested in being a respiratory therapist, great, we've doubled your training seats. If you want to be a nurse practitioner in Manitoba and practice your full scope, awesome, we have doubled your training seats at the University of Manitoba. So we've taken real steps to make sure that we can have more healthcare workers on the front lines, and we know that those are important investments to make. And of course, we have adequately and will continue to adequately fund the regional health authorities to make those investments strong.
Was this disconnect, kind of continuous? The audit started, in 2019? That disconnect has been continuous throughout. Was there any change when you took government?
When we took government, the audits were initiated almost a year ago now. And so for us, we knew pretty quickly coming into government and after a few months being in office that we needed some external expertise to evaluate what was going on. Throughout the audit process, our government has been able to identify opportunities to strengthen fiscal responsibility. We've identified many, many opportunities to invest in improving care at the bedside for Manitobans. We've added hundreds of beds to hospitals across the healthcare system. As I've already said, we've added well over 870 net new healthcare workers. We've added, just as a more recent example, 800 net new hip and knee surgeries in Selkirk. Right? We have been taking steps as a government to build more capacity in the province, while also understanding that the previous government's approach to healthcare was very damaging, and that the audits were highlighting some concerns that, of course, don't go away overnight. Right? These are not concerns that just evaporate because there's a new government. As a new government, we underwent these audits to make sure that we could understand the challenges, we could take real informed action to address them, and that work is going to be ongoing. So, we didn't get to where we are in healthcare overnight. It was 7.5 years, long years of a PC government cutting healthcare, closing emergency rooms, disrespecting healthcare workers, and creating chaos. It's going to take us time, real time, to fix that damage and continue to move things in the right direction, but we're doing the work and we're seeing improvements as a result.
Were there any, warnings that we could have a new interim CEO at this point? What kind of communication did you have with the previous CEOs about tackling this disconnect?
We, as a minister, I communicate very regularly. My team, department communicates very, very regularly with all regional health authorities and leadership. We work together to address the challenges in the healthcare system. The Premier and I have been very clear from the beginning that we want to ensure that we're giving everybody an opportunity to work in partnership with our government to make the changes needed to improve patient care, to improve healthcare across the board. And, as the minister, it's been very important to me to get a good understanding of how the system operates, how leaders function, how are they delivering on the mandates and priorities of government and the priorities of Manitobans. And so those relationships, are important in these roles. And as we move forward, I'm going to continue to maintain those relationships. I'm going to continue to work very closely with all of our health leaders to make patient care better across the province. But certainly, we've been very clear that we have expectations as a government that Manitobans see improvements in emergency room wait times. They see improvements in terms of staffing. They see improvements on the front lines of our healthcare system. And it's important that we take the steps needed to make those improvements happen.
Minister, just confirming that you are aware that these two regions were going to be announcing changes this morning?
The board chairs, I've been in communication with them. They've made me aware of the decision that they were making. I think we've got some questions on Zoom.
Yes, we do, Minister. Thank you. We have two outlets on the line today, Brandon Sun and Globe and Mail. Michelle, go ahead.
Thank you very much for taking my questions. Good morning. Minister Asagwara, is this a task-oriented document and exercise, as in are there instructions and specifically for Prairie Mountain Health going forward?
That's a great question. Thank you, Michelle, for that. The documents do have recommendations. There's a number of recommendations for government that have been provided in these documents. You are correct to highlight Prairie Mountain Health. There are recommendations specific to that region as well. And so we will be evaluating all of the recommendations. And as I said earlier, we've already taken steps to move things in a better direction for the health system and improve patient care and improve fiscal accountability, but there's much more work to be done. So, in Prairie Mountain, we know that, you folks know rather, that we've given the direction to reduce agency spending in 25-26 by 15%. We're working directly with them. We're working with Prairie Mountain Health, with their board, with their CEO, Trina, who is just a really fantastic leader, to make sure that we are making the improvements necessary and they have the support in order to do so. So, yep, there's a lot of information in these reports. They're pretty thick, but we're going through it. We're taking the recommendations seriously, and we're going to take action as needed to make sure patients have better care in the province.
Great. And my follow-up, taking a quick scan of this document, I see at least twice where it says Prairie Mountain Health cannot deliver services within the funding level. And you have even said Prairie Mountain Health has consistently been dealt a bad hand. So what is being done about increasing funding to this health region?
That's a great question. I have said previously, and I'll say it again now, Prairie Mountain Health was dealt a pretty bad hand under the previous government. They did not have any lines of communication to the previous government or their health ministers. They didn't have a partner in making the necessary steps to improve healthcare. And as a minister and as a government, we take very seriously our relationships with our regional health authorities. And so, Prairie Mountain Health is in a particularly unique situation where their deficit is almost entirely driven by agency use. And they geographically have some pretty unique challenges in terms of staffing. We have met with them many times. We meet with them regularly and will continue to take a unique and very tailored approach to staffing Prairie Mountain Health, to bringing folks back to the public healthcare system in that region. We're going to work with them very closely to make sure that they're able to bring down their agency spending. Our government issued an RFP because we recognize that there have to be controls in place in terms of agency use in this province. The previous government created a cottage-like industry for agencies, for-profit businesses, and we're taking a different approach. So, Prairie Mountain Health has a partner in our government and working with them to address their deficit, which is really driven by one thing. And we recognize that staffing the front lines and making sure they have those human resources requires investment from government, and we are providing those investments and will continue to.
Minister?
Thank you, Minister. Next up, we have Globe and Mail. Timur, you have one question and one follow-up.
Thank you, Minister. You've kind of answered most of my questions today about audits, but I want to switch gears just a little bit on a couple other healthcare files. Is there any update that you have on the critical incident review or investigation on Chad Christopher Giffen, the 49-year-old man who died at the Health Sciences Center emergency room last month after waiting for nearly 8 hours to receive care?
Yeah, that's a very, very tragic situation. That is something that still affects, obviously, his family, frontline healthcare workers. I've previously shared my condolences, and I continue to. It's a tragic loss that affects many, many people in communities. The work of the critical incident review is ongoing, and I will be providing an update once that's concluded and we have information that we can share.
Okay. My second question, again, switching gears on this, because I think it's important for people to sort of recognize that Manitoba, in particular, like many other Canadian provinces, has a very special relationship with the bordering U.S. states that we have, especially during this height of volatility between, our two countries. And so I wonder, from a healthcare perspective, has there been any changes to, the out of province patients that we take in from Minnesota? Can you sort of expand a bit and tell people, if you can, about this relationship that we have with the states?
Yeah, I appreciate the question. Obviously, this is a pretty interesting time for folks on both sides of the border. What I've seen here in Manitoba is folks really coming together to celebrate being Manitoban and being Canadian, being very proud to be Canadians, and really coming together to support our local economy. I've heard, interestingly enough, from a number of healthcare workers in the United States who have asked me questions about working in Manitoba. And so what I will say is that Manitoba is a place for everyone who wants to work in healthcare. We have created and have worked very hard to have good pathways for internationally educated healthcare workers, physicians, nurses, and other healthcare workers, and that work will continue. We want our healthcare system to be a diverse workforce. We know that diversity strengthens innovation in healthcare. We know that it strengthens and improves health outcomes for patients, which is the top priority. And so we welcome folks who want to be a part of our Manitoba healthcare team from wherever they may be from to join the front lines of our healthcare system. What I will say is that Manitoba provides healthcare to a number of folks who are not from our own jurisdiction, whether you're from Nunavut or Saskatchewan or Ontario, and yes, sometimes folks from the United States. And as Manitobans and as the health minister here, we take very seriously the responsibility to provide care to those where and when they need it. We've got good relationships with our partners who we share borders with, and we're going to continue to facilitate having good relationships with our partners to make sure that folks who need care in Manitoba are able to receive it and receive it well.
Thank you, Minister. That's everything from Zoom. We'll let you go back to the room.
Minister, can we talk about the measles reports that were made yesterday? Can you
Sure.
speak a little bit about that situation? And that's it. That's good.
Sure, of course. Dr. Rusin and the public health team have been working very hard to make sure that communication was released yesterday regarding measles cases in Manitoba. The bulletin has the full breakdown of details, but folks who need to isolate are being asked to isolate. Contact tracing has been completed, and public health, Dr. Rusin, who's our chief medical public health officer, will keep us up to speed as this evolves. It's very, very important to note, and I will say this to all Manitobans, that vaccines are safe, vaccines are effective. It is so important in a time where we've seen disinformation and misinformation rampant, that people talk to their nurse practitioners, they talk to their doctors, they talk to their primary care providers and get accurate science-based evidence information to take care of their health. And so at this time, the information that was released yesterday is really where things are at, but it's a situation that we're going to pay very close attention to make sure that our communities here in Manitoba are safe.
Do you anticipate there will be any more cases?
I can't really, that's a question better posed to Dr. Rusin and public health officials who have that expertise. They're keeping us up to speed. Public health in Manitoba is always working very hard to make sure they take the necessary steps to keep the public safe. That's their priority, and they're going to keep doing that.
Any more questions? We're good.
Okay, thanks everybody.